to increase the awareness that ratios are required in rural hospitals. We believe we need more nurses out here so that we get the same standards of care as what patients in city hospitals do.
We all feel strongly. We see every day what our patients have to suffer because they don't get the fair nursing care that they get in the city. And we're here to ask our National Party who represent our local areas just to discuss it in conference today.
There's actually a member here from every National Party electorate, and I think they're quite surprised to see us from all over New South Wales, just trying to put across our message that we need more nurses in rural New South Wales.
And to specialty areas like emergency departments, paediatric wards, intensive care units, and to community health. And I'm particularly passionate about community health ratios because I'm a community nurse myself.
Out in the rural areas, if someone presents at the small local hospitals, you need the staff to be able to give safe patient care to the patients that are already in the hospitals, as well as stabilise and get people ready to be transferred off to a base or a bigger hospital. I want my local MP to be aware of the importance of fighting for the cause of having ratios.
We've been campaigning here over the last couple of days in the freezing cold weather. We're not going to back down because this is an important issue for the future of nursing as well.
We came up yesterday, we met them at the National Conference for their welcome drinks yesterday. We had a candlelight vigil for them, just to say hello and let them know that we're here and we're serious about this. We need more nurses in the country areas and rural areas. Our current system is just unfair.
They have a point. I mean, if you have medical services, you know, you have to have numbers that can relate to the numbers of the people that they serve. So, because if there's too few nurses, then we have to have more nurses.
Now, you tried to get in there with some envelopes. What was that all about?
The envelopes are to our local members. We're asking them to come out at lunchtime. We'll provide them some food if they're going to miss out on their lunch, just to say, come and talk to us and we can give you stories about what's actually happening in country hospitals and why we're so serious about this. I had a nurse in my ward who broke down during the week because she had too many patients. I'm a nurse unit manager, and she came to my ward crying because she said, I just can't give them what they need at the moment, and she was distraught. And I want to get that story across to the politicians here. This is not about politics, it's about patient safety.
Yes, some of them are stopping and talking to us. I think the message is getting across.
What do you get? 3 times in 2 weeks.
And it's always nice to see you.
So we're hoping that the message has gone through to them in conference and that they will discuss extending ratios.
These 16 nurses and midwives from across New South Wales are here because we're passionate about patient safety. That's what this is about. It's not about money. It's about being able to have enough nurses to look after our patients.
Okay, I understand what you're saying. Let's hope we get a result that everyone can live with and that everyone's happy.
Trina Hodgkinson is our local member. She came down the steps out of conference and spoke to me. She said that she would like to have further conversations with me about the fact that there are not the same number of nursing hours per patient in her hospitals, in her electorate.
Yes, I think that some are genuinely concerned and willing to listen and take the message into the conference and talk on behalf of their electorate.
Yeah, well, hopefully a lot of the National Party members will get the message, because we're certainly sending it home to them.
What do you want?
Ratios!
What do you want?
Safe patient care!
What do you want?
At the end of the day, people still get sick, they still present at their local hospitals, and they have the right to expect quality care and safe care.
So we'll wait and see what develops.